To promote early diagnosis of cervical and penile cancer, the University of Guyana is hosting a free-of-cost screening for these cancers at its Medical Faculty of Sciences. Dr. Rajini Kurup, a professor at the Faculty of Sciences, told the newsroom during an interview that this is important because many persons who may have or may be infected with the Human Papilloma Virus may not know that it has transformed into cervical or penile cancer.
So they have almost 200 different strains of, more than 200 different strains of HPV. Not all causes cancer, especially cervical cancer is only a few strains that causes, like the aggressive ones being 14, 16, 18 strains. Some person could be asymptomatic and can be a carrier. So if somebody who is infected could lead into transmitting the infection.
So how does a person get infected with this virus? Well, according to Dr. Kurup, a person could have the virus through several interactions, including sexual intercourse. However, she said that persons who get vaccinated or get screening done early, they can detect whether or not they have cervical or penile cancer very early as well, and can therefore get treatment soon as possible.
Different stages of cancers, and they could have burning symptoms, they could have discharge, they could have pain and during sexual activity, dysuria. So they could look up all those chances, look up all those symptoms and could test for that and look for a screening test to confirm if it is because of that.
The Dean of the College of Medical Sciences, Dr. Cecil Boston, said that awareness of the HPV virus and early detection is important. That is why the University of Guyana is proud to be hosting this screening activity that will continue on to next Tuesday. He said that persons from the community and persons who are attending the university are free to take a stop at the Medical Sciences laboratory where the screening is being conducted.
Because one of the things that we really want to advocate is the importance of screening. And we know that screening leads to early detection, early diagnosis, and a better prognosis for those persons who may be positive for HPV. And so that is one of the premise in which the conversation started, and this activity is we're being rolled out on.
Cervical cancer is the second most prevalent cancer that affects women, and the ministry is now implementing several sensitization campaigns aimed at encouraging women to take their HPV vaccine. More than 34,000 deaths in the Americas are caused by cervical cancer. For this reason, early detection and diagnosis is important. Reporting for the newsroom from the Faculty of Medical Sciences at the University of Guyana in Turkine, I am Rajini Kurup.